Twyla said she will be 38 next week.
38?
38, and she's had problems getting pregnant. Is it too late for her to get pregnant?
So the question is, at age 38, is it too late to get pregnant? No, no, it is not, but the sooner the better. We wrote a paper that was published about 5 months ago, in which we looked at 24,000 cycles with natural and no stimulation. So we could determine what is the intrinsic fertility of the human embryo based on the age of the egg. And what we found is after age 35, there's a 10% drop in fertility every year. And so at age 38, she's going down that slope. And she knows it. She knows that she's in a category, age-wise, or at least age of the egg-wise, where she's going to be likely to be infertile. So the pregnancy rate with IVF for 38-year-olds is certainly going to be lower than, what was your age, 32?
I was actually 34.
34.
Right.
So you were not quite on that cusp where you begin to get a 10% decline every year. But surely you can get pregnant at age 38 with your own eggs. And what I advocate is a minimal stimulation protocol for those women, mini IVF, because we're not going to get that many eggs anyway. What we want to do is get the best quality eggs by not overstimulating them. So we have many cases like that. Sometimes we'll freeze those embryos and do another cycle a few months later because their eggs are just going to get older and we want to get them before they get too much older. So she might have 4 or 6 embryos stored up before we actually do a transfer.
That's interesting to know. I actually was wondering that myself. So the lady you were saying that was 50 and she wanted to use those eggs, or the embryos I should say, then technically those were her 30-something-year-old
Her 35-year-old eggs, right?
Because it's
exactly.
not necessarily your womb that's getting too old, it's the...
Yeah, it's not your womb at all. There may be problems with the uterus or the womb that we can take care of and fix, but that's not related.
It's the eggs that
the eggs are the issue. So if you were to put young eggs or embryos derived from young eggs into an old uterus, the pregnancy rate is the same as if it were a young uterus.